Welcome to the presentation about a quantitative critical appraisal checklist to evaluate quantitative health studies. I would like to disclose relationships with Laurentian University, Nossum University, and Ontario Health. This session has not received financial or in-kind support. Critical appraisal involves carefully evaluating research to assess its credibility, utility, and relevance. It is often included in undergraduate and graduate health-related curricula. This skill is received with varying degrees of interest and involves critiquing what was done well and what was not. I have taught quantitative critical appraisal skills to medical students, undergraduate social work students, and graduate students for almost 2 decades. A variety of checklists exist to critically appraise quantitative health studies. This presentation showcases a checklist for critical appraisal of quantitative health studies developed by me. The checklist is as follows. Comment on the study title. Is it interesting, informative, catchy, and is the geographic location of the study mentioned? Do they briefly discuss if an interdisciplinary team is involved? And are any important disciplines missing? Is an informative, balanced, well-organized, and written summary of the literature provided in the introduction? Did they miss anything that you consider important? Did the authors clearly identify why the study was done? Quote research questions. Comment if they are clear, well-written, novel, and easy to locate. Was a framework used? If so, which? Is a specific study design indicated and is it appropriate? Were the methods appropriate? Where relevant, inclusion and exclusion criteria, sample size required calculated, sample selection described, recruitment methods described, questionnaire instrument or scale used, and content and comment on questions asked. Was an incentive used and the type? Was ethics approval sought and where? Were appropriate statistical tests used? Who funded the study? For the results, were the tables well formatted? Do the numbers add up? Was the information presented well and clearly? Discuss response rates, summarize overall study results, and highlight the main statistical results. For the discussion, what were the study conclusions and implications? Indicate which findings were consistent and inconsistent with previous literature. Were the study limitations and strengths adequately described? Note any statistical concerns, name possible types of bias, and were there any potential conflicts of interest? Comment about the study generalizability. Discuss the study benefits and applicability. Provide suggestions for further study, both yours and theirs. How well written was the paper and abstract? Comment about ease of reading and understanding. Overall, what did you think of the study? Would you recommend it to others and why or why not? If desired, you may add other important information. Various checklists exist for critical appraisal of quantitative health studies. In my classes, undergraduate and graduate health students have been offered the choice of using various quantitative checklists, but this was the one most frequently selected and was favored for clarity and ease of use. Although the checklist has not been validated, it has displayed widespread popularity and applicability for use with various specific quantitative study research designs. An earlier version of the checklist was published for use in critiquing quantitative occupational health studies. This author is open to suggestions for improvement in the checklist and opportunities for further evaluation. Thank you.